time for stalling. The wild, wild is calling. When you risk it all, you learn to feel alive. Oh, searching for new life. Oh, reaching for new heights. Whoa, into the daylight. So open your eyes, we're making the climb, taking the dive, deep into the wild. Oh, into the daylight. So open your eyes, we're making the climb, taking the dive, deep into the wild. Deep into the wild. Deep into the wild. Deep into the wild.
Welcome to our webinar, everyone. With that, let us begin. Greetings and a very good evening to Director of Center of Foundation, Language and Malaysian Studies of IUMW, Yang Berbahagia, Madam Noraida binti Muhammad Sharif, our distinguished speakers, Dr. Nik Nairan binti Abdullah, Public Health Medicine Specialist, Mr. Kenneth Low, nutritionist and representative from National Cancer Society Malaysia. My name is Yashwini and I'll be your MC for this session. It is my pleasure to welcome all of you to today's webinar, Cancer, Myths and Misconceptions. This webinar is sponsored by Noah Group Resources. This webinar is a part of our Cancer Awareness Campaign, which is a product of collaboration between CFLMS and the National Cancer Society Malaysia, NCSM. To begin our session, I would like to invite Madam Noraida, Director of CFLMS, to share a few welcoming words.
Hi, good afternoon, everyone.
Good afternoon, Madam.
I think you have to unmute me. You mute me just now. Hello, good afternoon. Okay, you can hear me, is it? All right, okay. Good afternoon, everyone. Assalamualaikum to our speakers here. Good afternoon, Dr. Nik Nairan. I think I see you in. We were not formally introduced just now. Mr. Kenneth Low, thank you very much for supporting this webinar, which is organized by our students of semester 2 of the Center of Foundation Language and Malaysian Studies. Okay, now just a little bit of background on IUMW to Dr. Nik and Mr. Kenneth. IUMW is a collaboration of University of Malaya and the University of Wales. And the highlight of this collaboration is a dual award certification for our graduates, for the UG graduates mainly. Okay, now the Center of Foundation Language and Malaysian Studies has been doing a lot of webinars pending since the RMCO, the pandemic. Okay, and I think our students have actually almost excelled in doing a webinar now. I must congratulate the committee members of this webinar, because you have come up to this stage and planned, and having this webinar is that you will learn something from it. Now, topic for the day is on cancer, myth and misconception. Now there are a lot of myth about cancer. Everyone says cancer is something so detrimental to us, but actually it's not. We can prevent and we can prevent it actually. Now I just like to share because I just read it. I'm not sure whether Dr. Nik and Mr. Kenneth, the three Nobel laureate, that says that there are three things in cancer that you can cure it without having any without having to go through medication and things like that. Now one was on I read it that cancer cells will not survive with plenty of oxygen, so you must exercise. And number two, that cancer cells will not grow if you deprive it of sugar. Okay, so watch your diet. And the third thing, I think it was from the Nobel laureate, Japanese uh, doctor, a professor, and he said that fasting would be a very good way of trying to combat cancer. So I hope Dr. Nik and Mr. Kenneth can actually highlight or actually just a little bit touch on this verification of this, because I just read it actually on this and it's very interesting to know. Okay, so I wouldn't spend too much time making remarks on cancer. We'll let the experts do this and tell us the myth and the misconceptions of cancer, what is to do and what is not to do. Okay, so with this, I would like to thank again a very big thank you to Dr. Nik and Mr. Kenneth for sparing their time, their precious time actually. Everyone is very busy now to be with us and to give some highlights or enlighten us with some understanding of cancer, which is actually one of the modern disease of current of today, which is actually frightens everyone. Thank you.
Thank you, Madam Narida, for the
Hello.
opening remarks.
Yeah.
Throughout this upcoming session, if you have any questions for the speakers, please write it in the chat box. Our team will collect your questions for the Q&A session later. Ladies and gentlemen, now I would like to welcome our first guest speaker of the day, Dr. Nik. Welcome, Dr. Nik.
Thank you, Yashwini. Thank you for the invitation from the organizing committee, and also to the Madam Narida, as the director, Mr. Kenneth and Mr. Amuddin, and fellow students. Good afternoon, a very good afternoon to all the audience that are present today. Can you hear me?
And Doctor.
Yeah, all right now.
I've been given a topic to talk for this afternoon, and the topic is cancer myth and misconception. Can the organizing committee share my slides? Thank you. Okay, so as Madam Narida has mentioned, there are a few ongoing myths and misconceptions regarding cancer, because the cancer itself is something which is considered a stigma. Okay, it's a stigma in the society, and a lot of people are afraid to talk about cancer. So I will start my talk today with the list of contents. So I will talk about the global cancer cases, and then I will go to the definition, what is meant by myth and misconception, and what are the common cancer myth and misconception that we hear of. What are the impact of the cancer myth and the misconception to the society, to the community. And then I would like to also share information on the established risk factors for cancers. And lastly, what we can do as preventive measures to reduce the risk of cancers. So my next slide. Okay. So as we know, that cancer is one of the world's largest health problems. It carries a large burden in the sense of economy and social implication. According to the Global Burden of Disease, this is a database study on all the health diseases, and it has estimated that about 10 million of people have died prematurely as a result of cancer in the year of 2017. And all of the death, 1 in 6 will die due to cancer. And according to the WHO, the World Health Organization, there are few common cancers in men and also in women. But in men, you can see that the most common type of cancer are lung, prostate, colorectal, stomach, and liver cancers. In women, the most common cancer of breast, colorectal, lung, cervical, and also thyroid cancers. Now, cancer is a non-communicable disease. It is one of the common causes of death in the richer countries or the developed countries. On the other hand, it has been documented that in poorer countries, there is a poor survival rate due to cancer. So what is the contributing factors to the increasing incidence of cancer cases in the world? There are two factors due to the growth of population. As we know that the population will always experience a growth, and because of the factor of aging, more of the population are going into aging, and aging itself is a risk factor for the development of cancer. Now, I will share with you a graph from the Global Burden of Disease in 2017. So you can see from the bar chart, this is all of the cancers listed and which has caused death worldwide. And of all the cancers here, the most common cancers that have caused death are the respiratory cancers, which consisted of trachea, bronchus, and lung cancer. Then secondly, we have the gastrointestinal cancers, which is consisted of colon, rectum, stomach, and liver. And then we have the endocrine cancers of pancreas and pancreatic. So you can see here that respiratory lung cancers are far most the most common cause of death relating to cancer globally. Now we move on to the age group factor. Now I mentioned previously that aging is the factor for the increasing incidence of cancer cases. Now, if we look by age group, the cancer death rates in 2017, the age group that's most affected will be the age 70 and above, followed by 50 years old to 69 years old. But if we standardize the age across all age, there is a 121.21 rate, which is measured, which means that 121 individuals per 100,000 will die due to cancer. Now, this data supports that the more population goes into aging, like in the developed countries, the more we expect cancer cases to increase. Now, this is a very interesting graph. It's a prediction. According to the WHO Global Can, they predict the global cancer cases from 2012 till 2035. And you can see there'll be a slow increment for the world cancer cases. Now, it will be contributed mainly by the less developed countries or the developing countries. But if you can see the graph for the more developed countries, the increment in cancer cases is small, which is in contrary to the less developed countries. Now, there are many possible reasons to why there'll be more cases in the less developed countries. Now, one of the cases could be of the nutrition of the population in the poorer countries. The environmental pollutants in their country could contribute to the increasing cases of cancers. But in summary, it will increase in years to come. And this is very important, like me in the public health field, to develop or propose preventive measures to control the spread of cancer and to reduce the risk of cancer in the community. Now, to the main topic of the talk, is about myth and misconception. Now, if we look by the definitions, a myth is a widely held but false belief or ideal. And for the misconception, it's a view or opinion which is incorrect due to faulty thinking or poor understanding. So these are the common cancer myth and misconception. However, there be more, but these are the few are the common ones that I found. Okay, when someone is diagnosed with cancer, like I told you, cancer carries the stigma behind it because cancer is associated with death. So when someone is diagnosed with cancer, the patient do not want to disclose the disease to the family members. Now, cancer is a death sentence. It's a misconception. Yes, cancer-related mortality is high, but it depends on the cancer itself, the types of cancer, the stage of cancer. But there are treatments, and the treatment option has improved tremendously through research. Now, according to the National Cancer Institute, the 5-year survival rate for some cancers like breast, prostate, and thyroid, the survival rate has increased to more than 90%, which means that after you've undergone treatment for that cancer, you'll be able to be free of cancer 90%, okay? Chances of 90% to be free of cancer. Now, the second myth or misconception, which has been mentioned by Madam Naraida, is about sugar. So cancer cells feed on sugar. And as we know that excessive sugar is not healthy. But sugar is not responsible for the spread of cancer. Why? Because there's a lack of clinical trials, and we have to give information based on evidence. But excess intake of sugar, as we know, leads to obesity, and obesity itself increases the risk of developing a lot of types of cancers. Now, thirdly, the misconception is cancer can be contagious. Cancer is not under the clause of infectious diseases. Under the Ministry of Health, cancer is under the Department of Non-Communicable Diseases or chronic diseases. Okay, some cancers, however, is due to viruses such as HPV, human papillomavirus, which is the cause for cervical cancer, and the hepatitis B and C virus can cause liver cancers. Now, there are other common modes of spread for these cancers, such as blood transfusion, share of needles of IVDU, intravenous drug users, and also unprotected sex. Now, often hear about the fear of going through treatment, okay? So there's a misconception that biopsy and surgery, these techniques can spread the cancer cells to other parts of the body. Now, it is important to note that biopsies is an effective diagnostic tool. We need to conduct biopsies. The clinicians need to conduct biopsies because that's the way to detect cancer. And avoiding biopsies lead to late detection. It will lead to the later stage of cancer, stage 3 and stage 4. And hence, it would also lead to poor prognosis of the cancer. Now, herbs. Now, we know that our community consume herbs, okay? And what about herbs in relation to cancer? There's misconception that certain herbs can cure cancer without modern treatment, okay? Now, like I told you before, there is no conclusive, large clinical trial on human subjects to investigate the effectiveness of a herbal product in treating cancer. So you will read that some scholars will document that there is no single herbal product which is effective in treating cancer. Now, some herbs in the website mentioned that if there are some herbs that helps patient cope with side effect of the cancer treatment, but what patients have to be cautious because some herbal products can be harmful. One, they're taken together with the chemo drugs and during radiation therapy because the herbal components in it interfere with the treatment. Therefore, it is best that the cancer patients consult their clinicians, their oncologists, before using them throughout the course of cancer. Okay, we often hear that people say, oh, there's no family history of cancer, so I don't have a risk of getting cancer. Now, cancer has been reported or studied is caused by mutation. It's the mutation in the genes, and there are two causes of mutation. One is the genetic, is the mutation, about 5 to 10% inherited from the parents. Now it's called familial or hereditary cancers. On the other hand, you can see that about 90 to 95% of cancers be caused by mutation that happen during the lifetime. Now this is the result of aging and also the exposure to environmental factors such as tobacco smoke and also radiation. Now pollution. Pollution is a big topic these days, and there is a myth that it's a greater risk for lung cancer compared to those who smoke. Okay, it is estimated that 12% of the risk of developing lung cancer in urban, of a populated city, is contributed to pollution. But you can see the larger percentage of risk is attributed to smoking. So here to see that smoking is still a bigger in comparison to the pollution. Abnormal growth is cancerous. It is not. Benign tumors, some abnormal growth are categorized as benign tumors, and they do not have the capability to metastasize. Nothing can be done to stay away from cancer. Now, nothing. There are preventive measures. Okay, the thing is absolute. Okay, so I will talk about more preventive measures in my later slides, which means that we can do something. We can do something to reduce the risk of getting cancer. Then illness to the supernatural factor and witchcraft. But cultural belief itself is not associated with cancer. Dermal cancer belief or witchcraft, or supernatural powers or ghosts, okay, etc. Emotional disability for us. Now, this is a very common misconception, but when it comes to emotional, you will always hear that people will say, "Oh, stress, a lot of stress give rise to cancers." Now, it is difficult to measure stress. Okay, the measurement of stress is complicated. It's not straightforward, and every day we are exposed to stress. But what differs is the spectrum of stress. Okay, but stress altogether, I have to emphasize, is not good for health. So, if has been studied a lot in cancer research, where during treatment, chemotherapy and other treatment, those with positive outlook or with positive attitude, it helps. It helps for their coping mechanism throughout the cancer. Now, the other misconception that you can hear from the community is that treatment, the modern science, the treatment associated with cancer brings no benefit. Evolved tremendously, and it's been more effective with less side effect. Okay, so when someone says to you, when a patient or the family members they have negative perceptions about the treatment, they will say that, "Oh, you will decide too much, you couldn't handle it." But with the new medications, there are less side effects. Okay, and because of the new modern cancer treatments, the survival rates has also improved over the last few decades. So why are we, because of the impact to the society, can misconception about cancer increase the level of fear? So when there's a level of fear, there's a negative perception. The community, there'll be a delay of seeking treatment. I think there's a problem now in Malaysia is because the late detection of cancer. Most of the cancer patients that have been diagnosed in Malaysia are at the stage 3 and 4. Okay, in these stages, the late stages, of course, it will be associated with high mortality, which means it's a higher death rate because the cancer has spread, cancer has been aggressive. And besides the level of fear, it's the lack of awareness about the risk factors, about the preventive measures, the gender cancer awareness programs is the most important initiative that some can see with cancer and misinformation. It will hinder the awareness about cancer prevention and what is the importance of the detection. Okay, for my next slide, I will talk about the risk factors for cancers. What studies have shown, what factors have been associated or related to certain cancers. Now, excess body mass, which is in another term is obesity, is responsible for 3.4% of cancers in 2012. And 110,000 cases of breast cancer per year were attributed to excess body mass, overweight, and obesity. Now, risk of cancer increases with the amount of alcohol consumed. Tobacco use kills more than 8 million each year from cancer and also from other NCDs. Infection, I've mentioned hepatitis B, C, and human papillomavirus are responsible for up to 25% of cancer cases in the low and middle income countries. Outdoor air pollution has contributed to 4.2 million premature deaths worldwide in 2016. Now 6% of were lung cancer deaths. Mesothelioma is the cancer of the outer lining of the lung of the chest cavity. Now this type of cancer is caused by a work-related exposure to asbestos. And then the exposure to all types of ionizing radiation, it increased the risk of leukemia and also a number of solid tumors. Chemical carcinogens like benzopromide, formaldehyde, and aflatoxin, which is a food contaminant. In certain parts, like in sub-Saharan Africa, aflatoxin is one of the major causes of liver disease in that continent. Ultraviolet UV radiation, and in particular solar radiation, it causes all major types of skin disease, such as basal cell carcinoma, squamous cell carcinoma, and melanoma. So those are the known risk factors which have been repeatedly documented in literatures relating to the established risk factors for cancers. Now, lastly, I will touch about prevention. Now, if you look at the WHO, there is a global action plan for the prevention and control of non-communicable diseases, 2013 to 2020. So the global action plan provides a roadmap to reduce the premature mortality from NCDs which include cancer being one of the NCD by 2025. Now, because we have learned that 30 to 50% of all cancer cases are preventable, which means that we're able to reduce the risk if we exercise these measures. So Ministry of Health has created awareness through health education and health promotion campaign on healthy lifestyle. So healthy lifestyle is composed of a few components. There's a healthy diet, and Mr. Kenneth, I think, will talk more on the nutrition aspect of having a good balanced diet with the less of intake of sugar, carbohydrate, and etc. And then we have physical activity. It's very important to increase our level of physical activity. And it's recommended to have 120. And then the control of tobacco use, the legislation involving tobacco use, the increasing taxation on tobacco is one of the preventive measure, and also of a non-smoking zone is also the measures taken by the MOH. Limit the alcohol use. This is through health education promotion, and also the control of accessibility of alcohol to the community. And then the implementation of vaccines for the secondary girls HPV, and then the hepatitis B and C is also by vaccination. So this is hepatitis HPV and hepatitis B in the immunization schedule of the MOH, and then they have, and also there is vaccines for hepatitis B as well. And the other thing is to reduce the exposure to carcinogens. For example, in the industry, there are measures to protect the worker from inhaling the chemical fume, and also the process of the chemicals. And lastly, due to the UV radiation, like some ethnic, the Caucasians, they have a higher risk of developing skin disease, melanoma. Hence, the importance of using sunblock. That ends my talk for today. I sincerely hope that you gained some information from the slides. Thank you for your attention.
Thank you, Dr. Nik, for a wonderful sharing. We are grateful for the time and effort you took to share all this information to us. The audience may not be aware about this misconception, whether it is real or not. So we owe you a special word of thanks for being here and help to clarify it with us. Now, we'll begin our Q&A session with Dr. Nik. During our survey, we chose around 2 questions to be asked to Dr. Nik from the public, and later we will open the floor to the participants. So the first question is, many people think that getting vaccines would help lower the risk of cancer. Is that true? Dr. Nik, are you here?
Okay, yes. Yes, some vaccines, which I have mentioned in my slides, HPV, hepatitis B, it can reduce the risk of getting that infection, because the infection itself is one of the causes of cancers, like cervical cancers and liver cancer. So it is true that it can help.
Thank you, doctor. We have one last question from the public survey. Why do certain food aggravate or causes cancer?
Now, when it comes to food, I think Mr. Kenneth knows more about this topic. Okay, food, certain food, it depends on how you cook them. And for example, cooks with achar is not good for the health. And then food with additive, okay, food additives may be one of the causes for the inflammation of the cancer cells, inflammation of cells to develop into a cancerous cells. But at the moment, I can't think of the precise food additive, but there have been numerous studies, especially in Nutrition Journal, about food in relation to cancer.
Thank you, Dr. Nik. That's all the questions from the public survey. Now let's take questions from today's participants. We have a question from Dr. Putri. How true that the usage of microwave contributes to cancer?
Now, about the usage of microwave, there's always been a conflicting evidence. Some scientists say that the radiation from the microwave can cause cancers, but there be other studies that contradict the findings. So, but the microwave usage has been here for a long time, for decades. As to note, it has not been documented under the national cancer that microwave per se is the major cause of cancer.
Okay, thank you, Doctor. We have another question from Ms. Rishiga. Can vaccine cure non-viral related cancer?
No. Why? Because there's no supporting evidence to say that vaccine works for other cancers that are not due to infection.
Okay, thank you, Doctor. And we have another question from Miss Patricia. Usually in media, it shows that mostly old people could get cancer. Is it true?
Yes, because according to the epidemiological studies, they have associated aging factor to developing cancer. Like what I've showed in the graph, in the age group of 70 and above, the incidence of cancer is higher compared younger. Now, I'm not quite sure the mechanism of aging, but it has to do with the very molecular, level of the aging and cancers.
Okay, thank you, Doctor. And we have another question from Miss Aishu. Would vaping be a good alternative to smoking to reduce the risk of lung cancer?
Vaping is, some studies show that vaping is far more dangerous than smoking, because in vaping, you inhale the evaporation of the carcinogens, all the harmful substances. And there have been studies that the vaping inhale, and if you inhale the vaping products, it causes a more lung defect than smoking. So vaping is dangerous, and yes, it contributes to respiratory cancers in the future, because the tobacco itself has a lot of carcinogens in it.
Okay, thank you, Doctor. Thank you very much, Dr. Nik, and thank you to the participants for the questions. Before we proceed to the next session, I would like to make a short announcement.
Thank you.
Attention to all attendees. Please stay with us until the end of our webinar to fill in the form as your attendance for your e-certificate. The link will be shared at the end of our session. Before we move on to our next session, we would like to play a short video about the public survey that we have conducted. Enjoy. Now, I would like to welcome our next guest speaker from the National Cancer Society Malaysia, Mr. Kenneth Low. Welcome, Mr. Kenneth.
Hi, good afternoon, everyone. So can everyone see my screen? I'm not sure because I can't see myself. Okay, now I can see myself. All right, thank you, Yashwini. So, maybe I'll just introduce about myself. So my name is Kenneth. I'm currently working at the National Cancer Society of Malaysia. So for your information, National Cancer Society Malaysia, or in short, we call as NCSM, is actually a cancer NGO where majority of our work actually resolving within the three main pillars of the task we do here. So it can be fall under the columns of educations, care, and also support. So in terms of care, we actually provide subsidized screenings and some clinical services in our HQs in Kuala Lumpur, near Kampong Baru. It's actually very near to Hospital Kuala Lumpur. So we provide a range of like health and cancer screenings at a subsidized rate. So that's number one. Number two, when we talk about support, we actually have a lot of cancer patients and cancer survivors, sort of like wellness activity, where we talk about supporting cancer patients, especially the children cancer, where we have a halfway home, where those are receiving treatment, they're actually staying with us in our premise as well. So when it falls back to the last column, we talk about education, which is my department's majority role, where we talk about raising awareness about cancer. And at the same time, we will teach people about what are the strategies to reduce your cancer risk. So this is actually aligned with the topics that I'm going to present today. So without further ado, I'm going to share my screen so you can see my slide here. All right, can you see my slide? Is that okay?
Yes, Mr. Kenneth.
Okay, all right. So, yep, let's just start here. Okay. All right. As you can see, today we're going to talk about strategies to lower your cancer risk. As you guys may be aware, it's now December. I mean, because of the COVID situations, I understand that everyone might thought time has passed real quick, but eventually it's come to the end of the year. A lot of people might think about like, oh, what should I do for next year? And perhaps you could list later certain things that I am going to highlight as your New Year resolutions. Make it as a goal to achieve for your health in terms, not necessarily in terms of cancer risk, but in terms of general health itself. There are actually certain tips that you could follow so that you can actually adopt, I would say, a much healthier lifestyle. So let's pick it like a small step at one point, and then perhaps you would pick up some ideas what I'm going to talk about. All right. So I suppose actually a lot of people here are rather young, and most probably cancer is sort of like a scary word. So in our premise, we don't really tell people like, cancer is a sunshine, you should like give it a hug or you embrace cancer. But we just highlight that cancer is not something so fearful, because fear is always because of unknown. When you understand better, you can actually handle the situations better. And I'm putting this picture here is because why suddenly cancers become a big or hot topics amongst all the youngsters is because our beloved Black Panther actually has been diseased because of cancer, of colon cancer in particular. So he actually died at the age of 43, but he was diagnosed at the age of 39. So in terms of cancer landscape, he is rather young. So this would answer one of the myths you guys have mentioned about does only old people get cancer? And Dr. Nik has actually pinpoint and highlight that no, it's not. It is true, but maybe the statement might change based on circumstances like, even young people may be more cautious about cancer itself. All right, so this is just some things that I would like to see whether everyone is paying attention or everyone just being a blank screen behind. So if you may raise your hand with the function, I just want to take a quick look. Like if you have heard about cancers, then you can just hit the button here, reactions. So you put up your thumbs up. Yep, I can see 1, 2, 3, 4. Yes, somebody's clapping. Oh, the slide's running. Okay. So I'm helping Mr. Amin here to detect whether the students is sleeping or not. Okay, fairly a number. All right, then I would ask further the questions like, would those people who have heard about friends or family members then remain your hands stay? So you don't remove your hand. So just put on your hand if you have known somebody in your family or close friends that has cancer. Okay, I will see more numbers is coming up here. So what I'm trying to pinpoint here is actually a very simple concept. We're talking about, when things hit you, then you are actually more aware about it. And it's precisely about cancers. When cancer hits our friend, our family, our close one, our loved one, then you felt like there is a need for you to learn more. So today's lesson is not always about learning more, because it's always about preparing yourself. So when the situations come, you are not as fearful as you thought, and you know what will be the right measures to do. All right. So this is just a very blunt introductions about cancer. I believe Dr. Nik has go through a very detailed one, but it pinpoint the last column here. If you can see the last bullet point where we say that cancers can happen everywhere except your hair, your nail. So those are the cells that is dead. So besides that, right, any part of your body could actually happen of cancer. So some things it could just really based on luck. Yeah, sometimes. But of course, now we're trying to say that how to make yourself luckier. So you will implement the strategies to improve your health so that you can lower your risk. But of course, there's actually two types of tumors we talk about when we say benign and also malignant. So sometimes, a lot of people was very fearful when they heard about tumor, they straight away relate it to cancer, which is not 100% true. Is because some tumor could be benign. It could be a fibrous tumor, so that very minimum kind of a medical procedure could actually remove it. So this is why you don't be a doctor yourself. When you have a medical questions, you ask the doctors to clarify those items. All right. So this is just giving an idea about the landscape of a Malaysian's incident. Of course, if you are looking at the numbers, we are actually slowly increasing. It's because our population is getting older and older. So there will be more cancers being diagnosed at one point of time. However, the top 5 cancers in Malaysia remain these 5, which is breast cancer, colon cancer, lung cancer, lymphoma, and also nasopharyngeal. So some of you might find very familiar with breast, colon, and also lung is because very self-indication. When I speak about lymphoma, it could be not so familiar. It's because lymphoma is only happening very common amongst younger adolescents, meaning to say we are looking at about age of 14 up to 25. This range of adolescents, young adolescents, lymphoma is actually the most prevalent. Last but not least, we talk about nasopharyngeal. You might don't click an idea about it, but if I mention Dato Lee Chong Wei, then you somehow relates that kind of cancer. And precisely the number 5 cancers, nasopharyngeal is the cancers that Dato Lee has gotten before. All right. So when we talk about stages of cancer, the questions will be like, what does it mean by 0, 1, 2, and 3? Dr. Nik has mentioned about it. So this is just an illustrations for you to see why does detecting cancer early is rather important. It's because when we talk about stage 0, stage 1, and 2, which is rather early, those cancers are remain at there. So it has not spread to other organ, which indirectly it's easier to treat. And you will have a better prognosis and better outcome. So 0 to 4, which means higher number is more severe. This is something simple. So I'm showing you the idea about Malaysians number here. So if you look at the total cancer cases in Malaysia, in terms of stages of diagnosis, right, more than half, in fact, about 64% of the cancer are being diagnosed very late. And being diagnosed late, what does it mean? So I put up a table for you. So if you are looking at these tables, this is the top 5 cancers we are talking about. So if you can look at the right column of the table, you realize that stage 1 survivor, stage 4 survivor. So let's just put an example of breast cancer. So when we talk about 87%, right, meaning to say that if 10% of patients being diagnosed as stage 1 breast cancer, 5 years later, about 9 of them are still survive, very much alive among you. You can't tell whether they are patient survivor. You can't, because they're as healthy as you, they could be. But if you are talking about stage 4 diagnosis, you realize that the survival rate has dropped about 4 times, which is only equivalent to 2 of them would have survived 5 years. So this is why we stretch and we emphasize a lot of early detection here. Okay, so until this point, there's actually just one very clean message here. Do your health screenings every year. If you have hit a middle age, meaning to say your parents, most of the case, you could tell them go and do their cancer screening every year as well. Okay? All right. So when we talk about signs and symptoms, I would like to take this opportunity to speak about this is because, you know, when you always Google about signs and symptoms, there will be a lot of ideas coming out like, oh, do I get cancer? For example, like constant headache for 2 months, or maybe I had cancer. Yes, who knows? But how does it differentiate between the sign and symptoms? So if you are looking at sign, it's actually something that is objective, so can be seen. For example, I will put there like nose bleeding. So when you are bleeding without a reason, when there is a lump that you felt, so if there is a bump anywhere of your body, which is something abnormal, that could be a sign because it can be seen by you, it can be seen by the physicians. But somehow, when it comes to symptom, it's very it's very subjective and it's very depending on the patient themselves. So most probably you heard that patients say that I'm painful, I'm feeling very tired. Fatigue here is not like you lazy bum that you don't want to do anything. Fatigue here is meaning you don't have the energy to start your day. And this is somehow very different from what you so-called tired. This is not tired. This is one level up of the tiredness, which you can't even move yourself. All right. So to put things in simplified, there's 3 keywords when you talk about signs and symptoms. Number 1, unexplained changes. Something happens to your body, you don't know why. There's like swelling, there's like bruising. Your body, your skin color, your skin suddenly has a mole. There's nothing that you have done and it happens. So unexplained. Be aware. Number 2, persistent. When you have been coughing, when you feel constant pain, when you have bloated stomachs for, let's say, a timeline of 2 weeks, perhaps it's time for you to be more alert and for you to find out like what's the reason being. Yeah, Malaysian is always being very strong in this point. We believe that one day the sickness will go away because we drink enough water and we rest well. But in most of the ideal situation, that is not happening. So this is always, you are the persons that most aware about your body condition, and this is the reason why you should be more aware about this as well. Last but not least, we talk about unusual changes, meaning to say those are the things that out of sudden it happens, nose bleeding. Unless a very beautiful girl walks between you and you believe that that will be the cause of your nose bleeding, if no, please get yourself checked if you are having nose bleeding from time to time for unknown reason. All right. So I have done talks about cancers in general. So you're now aware that I'm asking you to get screening and I'm telling you that what are the things that you need to get screened. So I'll move on to the second part of my presentations where we talk about risk factor. And this is precisely what are the things you can do. So before we talk about what are the things we can do, we talk about what are the things we can't do. In a nutshell, in general, these are the three things that you cannot do and it might cause cancers. Number one, old age. It's because you have been exposed to enough carcinogen. At the age of 60 years old, you might have eaten enough McDonald's compared to a 20 years old. So perhaps your exposures of carcinogen is much higher in this sense. That's number one, age. Number two, we talk about family histories. People often have that perceptions like if I have cancer, most probably because it's my parents or because of my gene, which is not which is not always true. It's because family history is mostly about 5 to 10% of total types of cancer. So sometimes it could be, but it's not the solid reason. Number three, we talk about gender. For an example, like of course, cervical cancer is only among women and prostate cancer is only among men. So we are talking that each gender will actually have a specific range of different cancer. And unfortunately, the risk for women are slightly higher than men. Yes. So that's some things that you can't change, you cannot do. So let's forget about it, forget about things that we can't do. Let's now focus on the things that we can do. So some of these might be very familiar to you if you are looking at the number. Number one, we talk about physical inactivities, meaning that you are living in a slumberland. Number two, we talk about unhealthy diet, meaning that whatever you think is very delicious, you think is very unhealthy, that is unhealthy diet. You all know that. So now we are talking like how to manage that in details later. Number three, we talk about alcohol and smoking. Of course, we are going to touch on it at the very last part. And number five, we are talking about overweight and obesities and how does that being a risk factors for higher cancer risk. Okay, so I will go down to each of the points later. Then I will share you the tips on how to manage. Okay. So according to World Health Organizations, there is a range of cancers or including other non-communicable diseases, meaning to say diabetes, hypertension, cardiovascular diseases, a range of good things. So this is actually about investment. You do one good deed, you actually get 5 things in return. So why not start next year? I mean, let's pass Christmas, let's eat as much as you want for this year, and then let's have a better start next year. Take it slowly, it's all right. Okay, so now I'm going into details about each of the elements. So first, we talk about body mass index. I know that everyone might be very much aware about this, but this could be a very good indications about how well you are managing your weight, because sometimes people could have the questions like, am I in the ideal weight or not? So if you could take this formula here using your weight and height, which is something simple, and you can also type on, let's say online, just like BMI calculator, it will eventually comes out. But what you have to be focused on is actually the range itself. If you are falling within the normal range, so that's something good for you to maintain. But if you are falling above, like let's say overweight, or you are falling above underweight, so there's actually some things that you might need to take care of. But most of the time, we are not afraid about underweight. We are more afraid about obesities or overweight because this is more prevalence, perhaps. More fat people you see, yeah. This is not, I would say this is not body shaming, but this is telling that perhaps there are some things that you could do and some things that you want to do here. So here comes to the point that why does being obese or overweight has a higher risk is because if you realize that some people, when they have a higher, I would say a bigger waistline, they actually has more visceral fats, meaning to say you heard people say that the fats covering your organ, yes. And these fats actually will contribute to long-term inflammations and thus increase your risk of cancer. So this is why being fat not causing cancer, but being fat make your bodies inflamed, and the over long time inflammations makes your body sick and substantial to the genetic changes. So this is why we're telling everyone that if you could, try to maintain your weight at a very minimum. But this is of course maybe the most difficult one. So later I will give you a more easy task to achieve. All right. So move on to the next one. We talk about the waistline. So ladies, you might just want to take this as an image as well. It's because I'm putting here on how do you measure your waistline. So you take a measuring tape. So the waistline should be with your a same line with your belly button. So that please remember to exhale, then only you take the reading. So instead of inhaling, then you take your reading. So why am I telling that female has to be more particular on this is because one good thing that you learn that you might be at a middle, meaning to say yellow or green risk level. And another thing that it helps your online shopping. So that next time you are more aware about the sizes that you might want to pick and you will be more confident in this. So perhaps it's actually a good picture for you to take. But nevertheless, I'm trying to tell us that this is actually another indications for you to know what are the goals that you might want to pick for your waist circumference, okay? Including men, of course, who likes to do online shopping. Yeah, no offense taken here. Okay. So it comes back to the questions like when talk about weight, okay, so how do you manage weight? There's a lot of different saying, but it's only come back to two main messages here. Number one, we talk about reduce your calorie intake, meaning to say jaga your mulut. Number two, we talk about increasing your physical activities, meaning to say be more proactive. So there is actually something very general like, okay, jaga mulut, what are the more simple tips that I can do? So here I'm giving it to you. So if you are talking about intakes, meaning to say eating, in general, these are the three things that you could follow. And this is the easiest things, regardless whether you lose weight, you gain weight, no. But this could be the three main message that get across that you could felt you should do. Number one, pick nutrition dense food, meaning to say whatever food that you eat is nutritious. If you're telling me that a bag of Twisty compared to an apple, if it's equivalent of calorie, which one you choose? Actually, you know the answer, but you want to choose Twisty because it's tastier. Yes, I eat KFC as well. Once in a while, it's fine, but nobody asks you to eat KFC every week, right? So just it's about choices and it's about moderation. So choose nutrition dense food if whenever possible, meaning to say avoid snacks if you can. Number two, if you are actually drinking sweetened beverage, not your milk tea or whatever flavored tea or whatever handcrafted beverages or even Starbucks, anything that tastes sweet, if you may take it as a step, try to think about it. 1 week you only drink once as a small goal, you might realize that actually your weight can be maintained somehow because a lot of hidden calories actually come from beverages because it's not a meal. You're not full, but you take it like a snack and it's actually very high in calorie because when they present you the Starbucks coffee, they say, sir, here's your coffee. Then they'll say, sir, here's your 500 kilocalories. So some things that you might want to think of when you order next, or you could opt for low sugar if for milk tea. But the best is always no sugar, and the best drinks, if you ask, it's always water. Yes, it's cheap and it's healthy. Okay. Last but not least, we talk about fruits and vegetables and whole grains, which I'm going to stress more in the later. Okay. So when we talk about physical activities, why is it so? Is number one, because we want you to lower your weight, meaning like you might decrease your weight, berat badan. And then number two is actually increase your muscle mass so that you look more shape or you say in toned. All right, but that will be like resistance training, muscle training. So it's like a level 2. So we don't go so much, we go with level 1 first. We talk about physical activities. So why I'm not talking about exercise and I'm talking about physical activity is because physical activity is not something science. It's just how active you are, how much you are willing to move. As long as you're willing to move, you should be considered as active as possible. If you are looking at the recommendations boxes here, 150 minutes, right? So if you divide by 5 times, meaning to say one day, please do half an hour activities. All right. So later when I introduce some activities, some of you, if you are like a son or a daughter, then you might find that those are the way that you should help your parents. Okay. So we talk about how do you increase your physical activity. Number one, of course, increase your walking. Now, because of COVID, everyone just stay at home. You used to walk around in campuses. Now you just sit in front of your computer. So perhaps it's time for you to rethink like what you should do during late evening later. All right. So number two is equivalent of your long sitting time. Of course, I'm sitting and talking to you. I can't just walk and talk to you. Yes, too idealistic, but somehow make some time. Number three, we talk about taking public transport. Again, this is because of COVID, but there is always something you could do at home. Let's say like rope skipping, or just go to the park, which is now CMCO, you're allowed to do some outdoor activities, which is much easier. So 4 and 5 is actually for younger kids where if you have like niece and nephew at home, if you have a pet at home, or last one is always I'm telling the parents like, oh, please get your kids to do the chores for you. So indirectly, you are helping them for physical activities enhanced, and also you are helping yourself to get your house clean. So it's like one stone with two birds. Why not? Okay. So perhaps today you might want to start to help your parents to do some chores, just as simple as like washing dishes, like do some gardening, just water the plants, or wash their car. They will be thrilled by end of this evening, I suppose. All right. So next we move on to fruits and vegetables. I'm going to skip the part when I tell you like, oh, eat fruits and vegetables is very important. Everyone know that. But how much fruits and vegetables we should eat should be the issue. When we talk about fruits, right, we actually recommend 2 servings of fruit. What do you mean by 2 servings of fruits? I suppose every one of you are not a strangers to uncle or auntie who's selling cut fruits at the roadside. So if you purchase any one types of fruits they have cut for you, that's considered as 1 serving. So they serve you 1 slice of papaya. They serve you a half cut of guava. They serve you a cut of mango. Name any fruits that you can find and any fruits that you want to eat at the auntie or uncle stores that will consider as 1. So your target here is actually eating 2 different bags. So instead of buying some snacks itself, so you should now switch to buying some fruits perhaps. All right, so that's how much of fruits you should take. When it comes to vegetables, it's a bit difficult for you to visualize, but if most of you are eating at home or you are going out eating mixed rice, you know sendok, the scoop that we do. So when you take 2 scoops of 1 vegetables, it's almost equivalent of 1 serving. So the easiest always to tell people is like, there is 3 meals per day. So each meal just eat 1 type of vegetables if you can. So now take a reflection and think about, do you achieve your vegetables intakes every day? So that's some things for you to think about, and then some things for you to work on it as well. All right, so fruits and vegetables, yep. So there's a few tips for you to try. Number 1, encourage yourself. Mix around the different colors so that it's more attractive. You felt it's more motivated to eat. Today you have eat kiwi. Don't buy kiwi for a whole month. Yeah, maybe like 3 days you eat kiwi, then move on to another fruit so that keep yourself motivated. Number 2, be more creative. If you are looking at like now, a lot of people has been posting like Japanese styles of bento or even like Western style of breakfast, you realize that they will have their savories, meaning like I would say pancakes and other stuff. And at a side dish, they're actually putting fruits. So you could actually do the same while you are putting the Instagrammable your meal, and at the same time you are eating the nutritious items into your stomach. Yep. So number 3, being more initiative. This is talking about going to school, going to work when you bring fruits along, because yes, you might not have a fridge with you, but bringing an apple or orange with you in a bag is not that difficult as well, right? So number 4, trying to make some new recipes about fruit juices and vegetable juices. And this is something that you could do for yourself, or you can do it at home with your loved one. All right. So we move on to the next one. We talk about whole grains. Again, the concept is like everyone know whole grain is good. Brown rice is good. Brown bread is good. But how much do you need to eat, right? So I'm making a recommendation here saying that in each day, if you could just replace 1 meal with whole grain. For an example, you are eating 3 meals outside. So one of the meal that you eat could consist of whole grain. For example, if your breakfast is eating bread and egg sandwiches, the bread itself could be a whole meal. There are some things that you could do. So just replace 1 meal or incorporate 1 meal with whole grain. That will somehow help you to be a healthier diet. That's number 1. Number 2, if you can't afford to do it in the morning or lunch because you are eating out, Then maybe dinner time, you could tell parents to prepare brown rice, because nowadays brown rice is not as expensive as last time and is readily available as well. Because when there is competition, price will come down. So it's not that expensive anymore. Okay, so we are talking about replacing the whites to the brown if you can in one meal. If you catch your eyes there, it's actually popcorn. Popcorn somehow is actually a healthy snack, but when popcorn flavor with caramel or popcorn flavor with salt, it's not healthy. But if you can afford to eat popcorn in a plant flavor, meaning like there's no flavoring to it, yes, it's a healthy snack. So yep, I'm telling you to eat popcorn, but not caramel popcorn. Okay. So this is actually talking about red meat and processed meat. And this is precisely you all will know. When you go for your gatherings, you're eating hot pot, when you're enjoying your big breakfast with bacon and sausages, you knew the fact that they are all processed meat. And you knew the fact that they are not good. So there's actually not much of recommendation here. I would say if you can, try to avoid all those. If you can, try not to eat processed meat like canned meat, meaning to say your spam. I know that Korean food is now a very trendy stuff, but a lot of people have been switching to spam a lot. I mean, sorry, if you are eating pork, if you are not, of course, there's always the other alternative like chicken sausage, chicken nuggets. There's range of alternative products you could pick, but regardlessly, just try to avoid processed meat itself. Okay. So here is some tips when it comes to choosing protein. So number one, we always try to pick the leaner cut. For example, instead of chicken drumstick, if there is chance, sometimes you could switch to chicken breast. So it's less fat. That's number one. Number two, whatever your grandmothers and your mother's been telling you, like when you eat barbecue, try not to eat the burn part. They are actually very correct here, because the burn part are the carcinogens, which is increasing your risk of cancer. So they are telling you, please cut off the black burn part. Yes, please listen to them. They are right here. All right. Number three, we're talking about replacing red meat, meaning to say if you eat daging, meaning to say beef, you eat mutton, which means kambing as well. So those are the red meats that with higher calories or highest, we say, fats in it itself. So that's trying to replace with something leaner cut. So we are talking about chicken breast, we're talking about fishes or all kinds of seafoods. And also, if you are planning to do vegetarian diet once in a week, that's also recommended. You can pick some things like tofu and tempeh as a protein representation. So most of the time, you don't always have to pick, daging, always have to pick kambing. If you have the choice to make, please pick something else so that you know what you are putting into your plate as well. So this actually summarizes a lot of the, I would say, nutrition advices. If you can take picture of this one, and every time you eat something, right, compare your meal to this. And if your meal looks like this, you are pass. If your meal doesn't look like this, somehow, not say you fail, but there is room for improvement. So we talk about quarters of your food should be your rice or your carbs. If you're eating potatoes, they are considering here, they are not the green part because they are tubers. They are actually carbohydrates, okay? If you are talking about proteins, regardless of what protein, your fishes, your tofu, your, I would say, your red meats as well, they will be on 1/4 of your meal. And last, your vegetables actually should be covering your half of your plate. So this is actually a very nice show of how should your plate looks like. Yes. So every time when you think like, oh, is my diet healthy? Use this as a guideline. Is my plate achieved or not? Okay. So this is a very quick summary of that. So lastly, I just want to touch on alcohol and cigarettes because Dr. Nik has put up this point as well. We have known that the fact drinking alcohol actually links to 6 types of cancer, or maybe even more if the research have shown. And smoking actually links to 16 types of cancer. You might have the questions like, hey, know what? My neighbor has been drinking for 30 years, or my uncle has been smoking for 30 years. Touch wood, they never get cancer. Yes, it's all about probability, but when you does, your risk, meaning to say your percentage of getting cancer is higher compared to the other individuals. So this is why you will be aware, and this is why you should stop. Yep. I understand that for some, because of religious, if you are religious bound, then you are not drinking is fine. But for those who are open for drinking, so if you are looking at the servings here, so we are talking about average for women and men. I actually recommend the same. It's like if you may go and drink, you can claim yourself as a social drinker, maybe just one drink. So whatever drinks they have served you in the restaurants of one portion, that will be one drink, and that should be your standards. So now people are not afraid of cancer because of drinking. People are more afraid because of the saman they get after they got blocked. So thank God to that. So perhaps people drinking intake might be reduced during this period of time as well. Okay, so but my take here is, if you can, please avoid both as well. So this will be the last slide of my presentation. So this is actually a checklist for you to achieve by, let's say, next year. It doesn't have to be a New Year resolution. It could be just 1 month at one time. Perhaps this month you just want to try be more physically active, because don't forget, cancer itself is actually also an environmental, or we call it a lifestyle diseases. When you actually modify your lifestyle, you somehow actually reduce your risk towards cancer and other NCDs, meaning like diabetes, cardiovascular diseases. It's all equivalent, or rather same. So this is why when you do one, you actually get a benefits of 5. And I strongly recommend that you should start on this today. All right. It's okay that sometimes you think of eating KFC or McDonald's, but please, when there's a choices, go and eat something else. Yes, which is much healthier, because at the end of the day, you have now become young adult, or eventually you are adult. You can make a lot of decisions here. You can make a lot of choice here, including the food that you take. So with that, thank you very much.
Thank you to Mr. Kenneth for the informative session. It is a very interesting sharing, Mr. Kenneth. Now, many of us has gained some insights on the strategies to lower the cancer risk. We believe that the knowledge you have shared with us today will help immensely. Thank you for that. Now, we will begin our Q&A session with Mr. Kenneth. During our survey, we chose around 2 questions to be asked to Mr. Kenneth from the public, and later we will open the floor to the participants. So the first question is, many people think that getting vaccines would help to lower the risk of cancer. Is it true?
Okay, so for these questions, right, actually, I would say yes, but at this moment, the only vaccines is actually Gardasil or Silverix. That's the brand of the vaccines. But this vaccine is actually targeting on cervical cancer, which is only one type of cancer. And it actually doesn't cover a wider range of cancers like colon cancer, breast cancer. So in a nutshell, when you take the vaccine, it doesn't guarantee you don't get cancer. It's not 100%. It's actually give you a higher protection, something like insurance, but it doesn't guarantee you won't get it.
Okay,
So answer is yes. Yes, in a simple, yes, I recommend that everyone should take vaccines, because at least there is a protection. And we are talking about lifetime protections here, because you might not need a booster, not like hepatitis B, from time to time, you need to go back to the clinic to inject again. Vaccines is like you take it once a lifetime, perhaps.
Okay, thank you, Mr. Kenneth. And we have one last question from the public survey. Why do certain food aggravate or causes cancer?
Okay, so this is actually a good point. So when I talk about red meat just now, or processed meat itself, I would put that into these categories. Like those processed meat and red meat actually does indirectly they causes cancer, is because a lot of this processed meat, we are talking about hot dogs, sausages, hamburgers, and etc. Number one, they have high contents of sodium. So meaning to say they will increase your hypertension risk. So you will have, like we say, darah tinggi, right? Hypertension. So number 2, it also contains a lot of preservative, because they want to keep it for a longer period of time. So that those actually, in terms of long-term consumption, is actually not good for your body. So that it actually makes your body become more burdened in terms of processing. We call this actually like toxins for your body. So when you eat enough or accumulate enough, actually there is bad. Number 2, they also contain high fats. So indirectly, if you eat a lot of this processed meat, right, somehow there is a higher chance that you might be overweight. Yes. So this is why always people, when they say hot pot are very fattening, is because a lot of ingredients they use in a hot pot, and also because of the soup, is actually fattening. So yes, certain foods are really causing you has a higher risk of obesity, and the obesities and overweight leads you to cancer, not because you eating this food give you cancer. Okay.
Okay, thank you, Mr. Kenneth. That's all the questions from the public survey. Now let's take questions from today's participant. So we have Miss Sarah, Miss Sarah has asked, consuming almonds every day prevents us from getting cancer. Is that true?
Answer straight away is no. Yes, because it depends on which ideas you are coming. But almond is actually a very good source of proteins and fat, but you actually are not recommended to eat too much. Especially your almonds, we are talking about not the raw almond, the cooked almond. Because almond and peanuts are falling in the same category. When they are not cooked properly, they actually contains a toxin called aflatoxin. So when you consume too much, actually it could give you something like intoxication effect. You will something like we say you kena pemakanan racun. Yes, you will have that effect. So if you're eating too much of raw one, but if it's a cooked one, baked one, it's fine. But eating almonds doesn't actually prevent cancer because Sarah, just a very simple one. If it does, everyone will be cancer free.
Okay, thank you, Mr. Kenneth. And we have another question from Mr. Amin. Are drinks like Pepsi Black and Coke Zero actually healthier than normal Coke or Pepsi?
Okay, this is actually a very interesting point. Why does Pepsi Black and Coke Zero are healthier in a sense is because they use artificial sweetener. And what does artificial sweetener do is they actually doesn't elevate or they increase your blood sugar. This is actually special formula for people like diabetes patients where they can enjoy a little bit of sweet in their life without risking their life. Yes, but if we are talking about normal, like let's say general public who doesn't have a conditions like diabetes, you can eat whatever you want. So you are trying to game the system like, oh, I want to eat sweet, but I don't want to make my body's burden. Actually, in a long run, it's not good because your body couldn't respond to the normal glycemic response. That's number one. Number two, there's actually not enough studies to prove that in terms of lifetime consumptions of alternative sweetener, does it good or bad? So at this time being, we are being very conservative here and we don't tell people like, yes, everyone healthy should switch to artificial sweetener. But the key here is if you can avoid trying to reduce, I would say, sweetened beverages. But once in a while, if you want to drink, yes, you may choose, I would say, Pepsi Black and Coke Zero as an alternative. You can. So it really depends on what context you are using here. But if you are just saying, are they healthier? The answer very easy is yes, but I don't recommend you to binge drinking, like, or just drink it every day because Kenneth say it's healthier. It's not the right way to use it.
Okay, thank you, Mr. Kenneth. And we have one last question from Miss Aishu. Overweight versus underweight, which is more at risk to develop cancer?
Okay, at this moment of point, I would say perhaps it's overweight because your body inflammation is actually much higher in terms of your body inflammations in terms of like your body is always I would say it's in distress. It's very stressful in the situations that it has to fight your body against some condition. So this is why overweight actually leads to a range of different types of cancer, and it because a lot of biological functions at the back, the physiological functions. But in a nutshell, overweight actually leads to meanings like increase your risk of cancer. But when it comes to underweight, right, it doesn't mean that you are safe as well. Because when you are underweight, in the perspective of you are malnourished, meanings to say that you are kekurangan nutrisi. So there's actually a higher risk that you get infection, and there's actually a higher risk that your body will get attacked by various of viruses because your body is not strong enough. So there's actually a two-side story. I wouldn't say like which is more risk, but why when you ask this question, right, the question should be like, are you looking at maintaining yourself at normal weight? If that's your goal, right, regardless which one is, it's not that important. Important is whether you are at a normal weight.
Okay, thank you, Mr. Kenneth. We'll go for one last question from the participants. Dr. Putri has asked that cooking rice with Thermomix will drain out the starch or glucose. Is that good or may cause other bad effects? Is there any study that relates the usage of Thermomix and cancer so far?
Okay, so I see this question is coming from Dr. Putri. I will put myself in a very safe position. I don't know because I actually are not. I did not investigate or I did not go and studies about Thermomix. Thermomix is actually a brand, so I will keep my stance here is very neutral. I'm not sure. And as far as I know, if there is any studies, right, perhaps the Thermomix themselves would have released the journal articles. But from my database, I have not heard of this before. Yep. But if we are talking about the technologies can cook out or drain out starch and glucose, so I will have to read a little bit about the product because this is actually a product question.
Okay, thank you, Mr. Kenneth. Okay, thank you very much, Mr. Kenneth, and thank you to the participants for the questions. That marks the end of our Q&A session. Ladies and gentlemen, as mentioned earlier in the webinar, this webinar is only one of the 3 components of the Cancer Awareness Campaign. Another 2 is a public survey and a quiz. The live quiz will be held on the 13th of December at 13 until 4 p.m. on AHA Slides. The quiz shares the same title as our webinar, which is Cancer, Myths and Misconceptions, and the quiz will focus on cancer. We have cash prizes await for the top 3 scorers, made possible by Noah Group Resources. If you're interested, we'll share a registration link later. Now, we would like to play a short video about the cancer survivors.
Hey there, my name is Rika Sham. I'm from Kota Kinabalu, Sabah, and I am a recent cancer survivor.
I'm Clarissa here.
I was diagnosed with nasopharyngeal carcinoma. It's a kind of head and neck cancer which happens on the nasopharynx.
So I was diagnosed with neuroendocrine tumor, large carcinoma. It's just a very rare kind. How rare it is about 3% of the global population has this.
The cancer treatment took 6 months. I did a combination of chemotherapy as well as radiotherapy.
The treatment was okay. What was prescribed to me, or what was actually 6 times of tri-weekly chemo.
I had a very close family, and my husband is my biggest supporter, my biggest motivator. He encouraged me all the time.
And the stress he had to go through of not telling anybody of what I had, and he dealt it alone. Yes, they can try. Of course, they can try, but just be kind. Just take note that it's not the same.
But don't let that sink in too much until you can't get up and try to fight it.
Think of it as a pit stop. It's not the end, I think. It's not the end.
Words of encouragement and motivate them so that they can have a better hope.
Thank you so much to Rika and Clarissa for their wonderful sharing. If you're interested to watch the full video, please visit our YouTube channel at NS Cancer Aware RUMW. Before we end the session, we would love to invite the speakers and all attendees to turn on your camera for a quick photo session. Can we get everyone to turn on your cameras? Can we get everyone to turn on your cameras, please? We'll take a quick photo.
So this will be another catch by Mr. Amin to see whether students are sleeping or not.
Give us a big smile, everyone. Okay, thank you, everyone. Now, now we will display the QR code for the attendance form. The form will be used to issue your e-certificates. We'll also be providing the form's link in the chat box. The other QR code will link to the online quiz. Do register and stand a chance to win great prizes. With that, we have reached the end of our session. We hope that all of you found today's session to be informative and educational. Thank you to our wonderful speakers, Dr. Nik Nairan and Mr. Kenneth Low, for gracing us with your presence. Also, thank you to the lecturers from the School of Science and Psychology for your advice. Yes, Mr. Kenneth?
Yes, yes. I just wanted to share one more thing. If I may share my screen, just a very quick one. Right. Now, I mean, I'm just wanted to take this opportunity as well because I realize there's a lot of young people in the audience. So perhaps you guys, if you are interested to find out more about cancer's information, you can always follow our Facebook. Is because every month we actually put up a lot of education material. And those material, like, it's not like just one whole document for you to read. Most of the time, it's just one post conveying just one message at a time. So perhaps in that way of learning, you can actually gather much more information about cancer and in a shorter, I would say, spacing around. So instead of like giving you a textbooks to read, now it has been converted into each post by itself. So you can actually just follow our Facebook and also Instagram so that you can get those informations very handful. And then you can see if there is anyone or any persons you know they will need helps in terms of cancers, any types of support. You can actually call us up at our cancer toll-free line. I didn't display here, but you can get the information from our official website. So it will pop up there. So thank you. Yep.
Thank you, Mr. Kenneth. Last but not least, thank you to CFLMS and IUMW for the opportunity. My name is Yashwini, and it's been my pleasure to host this webinar. We wish you all a pleasant day. Goodbye.